Hi, my name is Lyle Murphy, the founder of the Alternative to Med Center, and today we're going to be talking about Zyprexa. The first question is, what is Zyprexa? Well, Zyprexa is an atypical antipsychotic, which leads us into question 2. What is it used for? Zyprexa is used for primarily for psychotic control of psychotic symptoms. People who go into psychosis, whatever the reason might be, they could have missed a meal and been hypoglycemic. They could have been in a spiritual crisis and needed support that they didn't get. They could have smoked pot and had a marijuana-induced psychosis, or they could have snorted too much Adderall while they were in college, or have be mysterious as to why. And when a person starts to disjoin from reality, they start having loose associations or paranoia, or thinking that they're being persecuted by spirits or hearing voices. This is a type of drug that is given for. Question number 3. What does Zyprexa withdrawal look like? Well, it largely depends on who is undergoing the Zyprexa withdrawal. It's going to look a lot different in different people. But it could be, for the candidates that we have here that are good candidates, a good analogy might be driving a logging truck down a mountain. And if you can imagine, this mountain has switchbacks and it's all iced over. I mean, it's really a delicate drive to get down the mountain. You need somebody that knows how to drive, right? You need somebody that's going to be able to drive this truck down the mountain with skill and hopefully not have someone grabbing at the wheel, especially when you're hitting these hairpin turns right next to the cliff. So when a person is coming off of Zyprexa, and this is the thing to know, and this is the thing that's really missed by most people. I mean, this is very uncommon knowledge that you're going to hear here, is that this drug, if you can imagine a synapse looking something like this, here's the part that holds the dopamine, and this is the part of the synapse that has the receptors and catches the neurotransmitter, the dopamine. So when you get a nerve impulse coming from this side, it will release the dopamine, it activates this side and carries that message on down to the next nerve. So that's the normal process. Well, what the drug does is it takes this part and blocks it off, so that this part isn't able to release dopamine. It's stuck in there, right? The body does a very fascinating thing in response to this, because if there's one thing that innate is going to do, life is going to do, it's going to look for ways to survive, right? So you need to know what position your foot is on the ground and how level your head is to the horizon and the position of your jaw and all of these things that require a bit of stimulation, right? Because that's what your survival is wired into, right? So what the body does is it just builds up more dopamine receptors to compensate for the dopamine that's being held back. So the little bit of dopamine that does get through past the drug has a higher chance of exciting something so that the person has a more normal physiology. So you can imagine what happens when you all of a sudden take that drug away and you get more dopamine hitting an excessive number of receptors. It's called hyperdopamine. Well, we don't have a name for it exactly, but it's a hyperdopamine effect where you're getting a dopamine surge that is hitting these receptors. So what dopamine is, it's the neurochemical equivalent of reward. So if you can imagine getting a huge tidal wave of reward where everything is rewarding, okay, so that's going to be these manic moments. So the sweet spot is it's going to happen. You're going to get this dopamine surge when you start coming off this drug, especially if you've been on it for a while. So the sweet spot is having a dopamine surge where you're still eating, you're still sleeping, you're able to talk about the things that are coming up, and being able to integrate those things in a way that's not having the truck drive off the road. So if a person stops sleeping and a person stops eating, these are warning signs that a person needs to go back up on the medication and do it slower. On the average, I mean, it is a broad stroke average. I mean, everyone's different. the upregulation that can happen to the dopamine receptors spans from 37% to 98% uptick based upon genetic variances. So that's a wide range of effects. But if you wanted a general rule, it's going to be about 1 month for every 1 year that someone has been on an antipsychotic like Zyprexa for them to be able to get off of it and not drive the truck off the road. Some people can go faster and some people need to go really uber slow. One of the ways in which there's a bridge medication that sometimes is used, which is Depakote. We do use Depakote here in people who are, sort of having a hard time getting around those corners, especially at that last hairpin corner when you're getting off of the antipsychotic medication. That last 0.25 of Zyprexa, that last 0.5, somewhere in there is generally going to be the most noticeable. That's a good time, maybe even that last, 2.5 milligrams. Excuse me, I got the dosing a little bit wrong on that one. I was thinking about Risperdal. So a low dose of Zyprexa would be 2.5. So let's say somebody's coming down from 20 down towards 0. They go from 20 to 17.5 to 15. But when they get down to 5 or 2.5, that's basically the time where you want to start using possibly Depakote. And check with your prescriber if that's a good thing for you to do. But that's sort of like hitting the brakes right at that last corner so that the hyperacceleration that's happening has something to kind of help buffer it around the corner. Next question. Am I schizophrenic if I take Zyprexa? Well, not necessarily. We have a rather, we've been at this for 15 years. The people I see that the drug works for and they're more or less normalized by the drug, they're exactly the type of people that could consider not using the drug because the drug doesn't have the capacity to fix a organic brain damage. The difference to me between schizophrenic and schizoaffective, and please understand this is my own definition, if someone is symptomatic all of the time and they are having psychotic symptoms, hearing voices, delusional, and they've been like that without any relief for, years and years, even a decade, that speaks differently than someone that has intermittent symptoms. Someone that had intermittent symptoms, especially if there's some kind of a cause, you can nail it down to like, they started doing marijuana or took some mushrooms or something. And then they have those problems more or less intermittently, especially when they go off the drug or forget to take it or when they drink coffee or do smoke some pot or something. Those are the type of folks that don't fit my definition of schizophrenic. Those are more schizoaffective. My diagnosis was schizoaffective. I suffered off and on for 10 years before I sort of learned how to navigate that one as I do now and help other people to navigate that as well. The schizoaffective population has a very good success rate here at Alternative Med Center, and we really like working with those folks because when you do get those ones right, everyone knows that you truly saved that individual's life because of the just huge train wreck that their life and everyone that they love would be when they do go manic or psychotic. There usually are very demonstrable things that kick the person out of the normal range into those states that can be identified and generally can be fixed without the use of drugs, or maybe with a minimum amount of drugs and not a complete decimating or anesthetizing of their mind and their brain and their life. What are the Zyprexa alternatives? Excuse me. Well, one thing to know is there's not going to be a natural substance that is going to give you the same hit as an antipsychotic. And I don't want anyone to think that you can just take an antipsychotic and replace it with a naturally occurring substance. We did those trials back 15 years ago, and there was more to the story than that. So a careful tapering process in conjunction with natural alternatives, those things can overlap and actually work. Some of the common Zyprexa alternatives are, if you look at Abram Hoffer and Humphrey Osmond's work, Canadian psychiatrists back from the 50s, extending up until the early 60s, they did a 9-year-long study. It was a double-blind study using niacin and vitamin C. We have found niacin and vitamin C to be at least capable of getting people out of the rafters when they are starting to go delusional, and also to be a long-term strategy to help people avert psychotic symptoms. Does it work in everyone? No, but we have seen it works in approximately 75% of the people to have good efficacy. So those are a couple alternatives. Another thing that is very common is the lithium orotate. People combine the lithium orotate with the niacin and the vitamin C. Not that those are the only nutraceuticals what we use, but those are the three probably most straightforward and easy to understand. Another thing is cardiovascular exercise. The oxygen will help move the dopamine through to make norepinephrine and adrenaline and help break it down. So oxygen is a cofactor for the what's called the catecholamine pathway. So getting extroverted, exercising, running, jogging, doing things that get your heart rate going up, those are things that are good Zyprexa alternatives as well. And now that brings us to the last question. Can Zyprexa cause tardive dyskinesia? Yes, it can. And if your doctor has not told you this, that is a bit of a professional foul, I believe, because tardive dyskinesia is largely irreparable. It's a motion disorder where apparently the way that the muscles contract or the dopamine works as far as muscle movement is altered to a degree that looks even worse than Parkinsonism. It is a horrific disfigurement. If you look up tardive dyskinesia, look up videos on that, I can only have great compassion for people who have suffered from that. And I believe that they should have been told that by their doctor. There are certain genetic polymorphisms, particularly the CYP2D6 and the 3A4, which may be involved in not being able to break down this medication well. If a person has those genetic polymorphisms, there is a chance that they could develop tardive dyskinesia or akathisia. Akathisia is the light version, I guess, one way to say it for tardive dyskinesia. But these folks that have that, a lot of times they'll feel agitation from taking the medication. They'll feel muscle stiffness. They'll start to feel maybe their diaphragm starting to seize up. Things like that are good signs that this medication may be having an adverse reaction in you. And it really saddens me that the court sometimes will, in their court-ordered treatment, when someone's basically mandated to take an antipsychotic, when there's a mother of a child that is screaming, no, this is not working for my child, and the mother knows what tardive dyskinesia symptoms look like and is trying to express that to a court who cannot hear her, and then the child suffers permanent neurological damage. The only other option that the parent would have is for the court to then take custody of their child if they disagreed, and they would end up in Child Protective Services where they would be getting the medication anyway. So a parent sometimes can sit on the sideline watching this thing unfold and not be able to do anything about it. And I think that the courts and even doctors are largely, I don't know, they're just not really focusing on the damages of these drugs. Sometimes the courts can believe that they're doing the right thing. They can believe in doctors who don't have much investment or experience with the child or your loved one, and can do things that are very damaging because of that lack of having a proper relationship or having proper oversight and follow through. Okay, that is the end of this session. I want to remind you not to do anything like change your medications or take any supplements based upon what you've seen in this video. You can call us and we can establish a doctor-patient relationship with you if you so choose, or you can establish a doctor-patient relationship with someone out there in your area that can guide you in ways, and you can use this video or this information to give to your practitioner so that they can work directly with you. Thank you and have a good day or good night.